So again, welcome everybody. I'm Rebecca Armstrong, the Director of Patient Education and Engagement with the Canadian Breast Cancer Network. This session is being recorded and will be available on our website for anyone who may have missed it, and I'll send out the recording once it's available. I'd like to extend our sincere appreciation to our sponsors for today's session who have provided support through unrestricted educational grants. Novartis, our gold level sponsor, Pfizer and Gilead, our silver level sponsors, and Bayer, Tercera, AstraZeneca, and Lilly Canada, our bronze level sponsors. The format for today's session will be a presentation by our speakers, and then we'll do a question and answer period for both after their presentations. Please feel free to submit your questions throughout the session using the Q&A function. And I'd now like to welcome our host for the session, Kathy Amendolia, the Chair of the Board for the Canadian Breast Cancer Network.
Thank you, Rebecca, and welcome again to everyone. Thank you for joining us today. I'm pleased to welcome and introduce our guest speaker, Dr. Sophie Lebel, who is a clinical psychologist and professor at the School of Psychology at the University of Ottawa. Dr. Lebel's expertise is on managing fear of cancer recurrence. Over the past 15 years, Dr. Lebel had been working on an FCR intervention called FORT, a group intervention for survivors that has been tested through clinical trials and is currently being culturally adapted in several countries. Clinically, Dr. Lebel works with patients who have the lived experience of a cancer diagnosis and their loved ones across all phases of the disease trajectory. Dr. Lebel, great to see you, and thank you for being here today. And we're also joined by Sarah Kalnek. Sarah was diagnosed with triple negative breast cancer in 2022 and now channels her lived experience into advocacy and storytelling within the healthcare space. She volunteers as a patient and family advisor at Cancer Care Manitoba and as a participant committee member of the Manitoba Project, a landmark 50-year study tracking cancer rates, demographics, and health outcomes. Thank you both. And with that, we'll turn it over to Dr. Bell to share her presentation.
Okay, well, thank you, and good afternoon or good morning. I see some of you are from the West Coast or a lot of people from Manitoba. It's a real pleasure to be here with you today. A lot of our studies have been done with women with breast cancer, and this is a cause that's really dear and near to my heart. My mother had breast cancer. There's a family history of breast cancer on my side, so something that's really important to me. I'm going to share my slide here, and I'd like to thank you all for being here, and thank you for inviting me. So I'll share my slide. Let's just make sure. Oh, no, that's not quite that. Let's try that again. So let's share that slide. There we go. We should be able to see that. Where am I? Okay. There we go. All right. So this is the title of the talk. This is the part one, the psychosocial perspective. And I'll show you what I'll be covering. So I'll be covering these 5 points. What is fear of cancer recurrence? I'll talk about some evidence-based coping tools to manage fear of cancer recurrence. I'll talk a little bit more about something called scanxiety. I'll talk about how to deal with health information overwhelm and rumination. And then I'll talk about communicating with your healthcare team, something that could be helpful for fear of cancer recurrence, and talking also with your support network. And we'll talk about when to seek additional help and what some resources, what some of the resources are that are available to you to help you if you feel you need additional help. I think I'll be speaking for about 20-25 minutes, and then we'll have time for some questions and answers after that. So starting with what is fear of cancer recurrence? So as scientists, we define fear of cancer recurrence as the fear, worry, or concern relating to the possibility that cancer will come back or progress. This definition is meant to include the experiences of people that have no evidence of disease, that are currently in remission, as well as those that are living with ongoing cancer and may be more concerned that the cancer will progress. This is what we call an unmet need. An unmet need is something, an issue, could be a physical issue, could be an emotional issue, a spiritual issue that you feel has not been addressed by your healthcare team. And fear of cancer recurrence, when we ask cancer survivors, what are some of the things you feel you haven't been helped with yet? Fear of cancer recurrence usually comes up as the top unmet need of cancer survivors. Now, I'd like to clarify and state right at the start that fear of cancer recurrence is normal. When we 20 years ago, we used to just simply ask people, have you had a thought? Has it ever crossed your mind? Do you ever worried about the possibility that cancer will come back? And when we simply ask you this question, 90% of you will say, yes, this is something that's crossed my mind. So having an occasional thought is totally normal. And we'll talk about how it might even be helpful for some. But then its severity can increase and then we'll reach moderate or sometimes even high levels of what we call clinical levels. So 60% of people report at least some fear. Some people now go into moderate. So this is something that's happening to them a few times a year. And one cancer patient out of 5 will report clinical levels of fear of cancer occurrence. These are people that might benefit from more intensive interventions, which we'll talk about towards the end. Women with breast cancer are a well-known group that's more likely to experience fear of cancer recurrence compared to other cancer types. And just something to mention that lately we've been studying family caregivers. So these could be spouses, common law partners, but they could be daughters, they could be sisters. And in general, we find that fear of cancer recurrence is just as prevalent in these family caregivers. I like here these quotes. These are taken from a recent article called Getting Out of a Dark Place, which asks women to, in their own words, talk about what fear of cancer recurrence is. And I thought I'd talk about this so you know that fear of cancer recurrence can look different from woman to woman. First quote says, whenever I feel any kind of pain or discomfort in the area where I had cancer, it concerns me and I feel anxious and irritable. Talking about how your body sensations can be a common trigger and how you can feel all kinds of feelings. You can feel sad, you can feel anxious, you can feel irritable. Second quote says, cancer is all around us. Everything is a trigger. Anniversaries, other family friends' diagnosis, commercials about drugs, so on and so forth. Highlighting to me that there's so many triggers that can, bring upon your fear of cancer recurrence. And for some, she said, it's a daily thought or a daily emotion. So I mentioned for some people, this might be an occasional thought, but the people I help in my studies are more likely to say this is something that they're dealing with daily. A third person says, I sit for hours doing nothing, do not turn on TV, sleepless, find hours pass by. I'm not participating in activities. I get lost driving. I'm deep in thought, compulsive online shopping. So there could be a range of ways of coping with this fear. Some are going to be more helpful than others, and we'll talk about that. But for some people, they're struggling to cope with fear of cancer occurrence, but there are interventions to help that. And that last quote, I think, talks about for some people, they do mention that having at least some level of fear has been helpful to help them stick to good health habits, such as here she says, it motivates me to maintain healthy habits, such as eating 5 servings of fruits and vegetables, working out, drinking less alcohol. It motivates me to maintain my physical health, my mental health. So having a little bit of fear might act as a motivator to do these things. And we'll talk about how for each person, a good enough amount of fear might be different. But hold on to that. The goal is never to get rid of all fear. Some fear is normal, and some people say it might even be a little helpful. I'm now going to move on into evidence-based coping tools. And I like this picture of a tool belt or toolkit because I often tell my patients that our job together is going to be about adding tools to our tool belt so that we have lots of flexible ways to deal with fear of cancer occurring when it comes on as a concern. I'm going to list some evidence-based, research-supported ways of dealing with fear of cancer occurrence, especially for people that have sort of occasional thoughts and feel like, okay, this is something that I sometimes struggle with, not necessarily on a daily basis. When this becomes more of a concern, we'll talk about what that looks like and we'll talk about some strategies for that. But first, sort of things I will encourage everyone to do is talk to supportive family and friends. So figure out from your network who might be someone that you could share some of your fear and your experience of going through cancer in general. I'm assuming some of you are part of a support group or supportive organization such as this one. So I think that's a great option to talk about things and then feel like you're in a safe environment with people that understand you. Self-care, that might look different from woman to woman. I mean, some people think of self-care as spending a day at the spa, but that's not what we mean. It could be going for a walk, spending time in nature, taking a warm bath, reading a book, um, doing yoga, whatever it is that makes you feel good and is, not necessarily super time consuming, but something that, is going to help you take care of yourself. Seeking appropriate medical information from your team. So we're going to have a whole slide on that, and I know I'll give you some ideas of what I encourage people to get in terms of information. It could be one-on-one with a healthcare provider, or maybe the cancer center where you receive your treatment offers a psychoeducational class on what to expect during survivorship. So once you finish your treatments, what can you expect during your survivorship? That could be a great way to deal with some of the unknowns and help you with your fear of cancer recurrence. After that, other things that I recommend is letting go of excessive reassurance seeking. So that could be spending too much time doing online research. Hence why I've put the Dr. Google here as a warning. Most people I work with understand that Dr. Google is not going to be helpful, that it can open up scary boxes. That doesn't mean you shouldn't look at information online, but choose, well-known, supported sources of information like the Canadian Cancer Society, and know when probably this is causing you more anxiety than bringing you good information. Sometimes we ask people also to stop seeking reassurance in terms of asking for additional tests and scans or things that are not recommended by their healthcare provider as part of their normal treatment follow-up. But if you're asking it just because you're anxious, we will also encourage people to decrease avoidance. So I work with many people who tell me I try to keep myself busy morning, night, all the time. My agenda is so packed, Sophie, you should see it. But at night, when I can't distract myself anymore, that's when it catches up with me. So being able to open that scary box, I often say that fear of cancer occurrence, the whole cancer experience for some people feels like, people put it in a little box, then they close the lid, and then they sort of lock that lid, and then they stuff the box under their bed. My role as a psychologist is to help you open that box, even though it's hard, and then gradually feel more and more comfortable and sort of looking at what that experience has meant to you and what you're afraid of. So, sort of taking small steps to look at that, and that could mean with a healthcare professional, mental health professional, in a support group, or with friends, or whoever might be a good listening ear. We talk about acceptance of what is under your, what dealing, coming up with a plan for what you have under your control, accepting and letting go of things that are outside of your control. Doing relaxation techniques has been a great way to deal with fear of cancer recurrence. That's evidence-based. So there are lots of relaxation techniques, videos you can find online, apps you can download to your phone. So those are a great way to deal with difficult emotions. When it comes to managing anxiety, health information overwhelm, and rumination, I'm going to talk about some general strategies for all of that too. Anxiety is a sort of fairly recent term that refers to the anxiety or different emotions that you may feel specifically around the time of a medical event, whether it's getting your annual mammogram, going back to the cancer center, getting an MRI, but it's the anxiety, the buildup of anxiety leading to that medical event while this is happening and while you're waiting for test results. So it's a few days or a few weeks of discomfort and that dread of what will that test show? Will it show that the cancer has come back? And for me, I identify all of these as a trigger. We talked about triggers earlier. A lot of breast cancer survivors tell us that aches and pains in their bodies are a very common trigger. The quote talked about anniversaries or hearing about other people's cancer. Going back to the cancer center, waiting for your test results, that annual mammogram, those are all well-known triggers. And when we have a trigger, we will usually have these thoughts that we call automatic thoughts, negative thoughts that will impact you. An example of an automatic thought could be my doctor will tell me that the cancer is metastasized for sure, even though there may not be any evidence, but that's what you're telling yourself as you're waiting for your test results. We, in our own terms, label that as you're catastrophizing. We teach people how to catch these thoughts and how to use more helpful language, how to balance it out, and then come up with something maybe more helpful to tell yourself. because this language will have consequences on how you're feeling. Giving some examples here where we'll feel some discomfort fueled by these thoughts. In terms of how to deal with skin anxiety while you're waiting, I often tell my patients, remember occasions where you successfully coped with uncertain times. We all go through uncertainty, whether it's changes in life circumstances, jobs, education, relationships. And we are, even though it's difficult, we are able to cope with uncertainty. A really good thing to help someone shift their perspective on their thinking is to practice kindness and tell yourself, what would I tell my best friend or my spouse or my sister or my child? What would I tell this person? And usually we will use much more gentle language with someone else than we will for ourselves. Come up with some sort of positive affirmation, what we call a mantra. My own favorite one is, I'm doing the best that I can. And I use that when I'm going through a difficult time. Other good mantras are, I'll cross that bridge when I'll get there. I'll deal with it if and when it happens. I can cope. I'm strong. I can do hard things. Bottom line, I tell people that I work with, waiting for test results is challenging. It's a predictable, challenging moment that this too shall pass. This is a moment you have to ride the wave. And I say to people, now's the time to engage in healthy distraction, planning to meet with supportive friends or family members, to go out. Now's the time to maybe start a new Netflix series, to engage in something that you know will help you, weather these difficult days. Now, when it comes to information overload and rumination, we're going to talk about an important concept, which is aim for an amount of worry that is just enough. So we talked about how a little bit of fear of cancer occurrence can help you feel engaged and paying attention to your health. That's good. We don't want you to get rid of that. But sometimes, just like seeking information here, it can get to the point where it's overwhelming. So I had a patient who told me, I used to be on all these Facebook groups for my specific type of breast cancer. And now I'm finding that it's not helpful anymore. I'm just overwhelmed. I don't want to hear these stories. So now she's past what we call peak performance. These groups are no longer serving her. So for all the ways you cope with anxiety, I want you to think about, am I doing too much? Can I dial it back down a bit? And that could be the same for seeking medical information. Same for rumination. If you find yourself sort of caught in a loop of where you're thinking and thinking and thinking about something, sometimes psychologists will prescribe what we call a worry time. Okay, we don't want you to get rid of this worry altogether, but we're going to prescribe for you like a window of worry. You notice a worry, but you're only allowed to go back to this worry and pay full attention to it between 4 and 5 p.m., let's say. So again, sort of realizing we don't want you to get rid of all your worries, but we want you to maybe dial it down and find something that is more manageable. And that can change over time. In terms of communicating with your medical team, your care team, and your support network, these are really powerful tools, and we encourage them in our intervention. So, in terms of communicating with your care team, I have some questions here for you to think about. The first one would be, how much information do you like to have? Some people like having a lot of information that is reassuring to them. Some people like to have it like presented in small chunks. Some people would rather not know certain things. So know yourself, know how much information you like to have, and then communicate that to your healthcare team. Like, I benefit from knowing a lot and I prefer to know upfront, or something else. I will encourage people to figure out for themselves if they will have what we call information gaps. Are there things that you feel like you don't know enough about when it comes to your medical history and what's going to happen down the road? So some common questions and some common things where I feel people do benefit from finding out more information is, what is the prognosis of my particular type of breast cancer? Where is this based? Where are you getting this prognosis from? Most importantly, what are the most likely signs and symptoms of a recurrence, as well as those not likely to be related to cancer, so that people find it easier not to interpret like a headache or cold-like symptoms as evidence that their cancer has come back. How many days should I have these symptoms before I call you back or I notify you, what should the pattern look like? What should I look like when it comes to paying attention to my body? What are some recommended behaviors that may help reduce my risk of recurrence? Exercise, smoking cessation. A lot of people have questions around diet. What will my follow-up look like? What's the schedule? What are the procedures? 'Cause sometimes when I do this in a group, women will have different treatment schedules, or they won't have the same frequency of certain procedures. And they'll be wondering, oh, why is she having that every 6 months, but I'm having that every year? So you might want to have some questions there. And then I encourage everyone to think who would be the best person amongst my care team to ask these questions to, and then maybe book an appointment or mention that you want a slightly longer appointment because you have questions, and get ready to write them down or record these answers. Bring a support person with you to gather this information. Now, when it comes to having difficult conversations with your support person, it could be your care partner, but it could be other people. I know this can be scary, and there's a whole bunch of reasons. Often people tell us, well, I feel like my family doesn't want to hear about it. Sometimes people with high fear of cancer recurrence tell us, I know that they're supportive, but I'm afraid of burdening them. I'm afraid of that my anxiety will be difficult for them. I don't want to overburden them. And some people tell me, well, my family tells me it's time to move on, that this is something that I should put behind me. So there could be a bunch of reasons, but we really encourage people to think about, the fact that if you're worried about this, chances are that your family is also experiencing these worries. Remember, I said at the beginning that fear of cancer recurrence is common in care partners. It is common also in both the patient and the care partner. So I call that the elephant in the room. I'm thinking about it. You're thinking about it. I know you're thinking about it. You know I'm thinking about it. But we're not really addressing this. So it's just this elephant and it just grows. So we tell people, let's think about who you'd like to have this conversation with. What do you want to tell them? What do you want to share with them? When would you like? What's a good time to share this? Where do you want to have this conversation about fear of cancer recurrence? A lot of people we've worked with were pleasantly surprised that the conversation was well received. When to seek additional help. So this is the last point I want to convey today. So it's normal to have some fear of cancer recurrence, but sometimes you might feel like, am I struggling more than I should, or could I get some help for this? Here are some clues. The first clue to me is if you tell me that you think you're struggling with this more than you should, that you're not sure that you're coping as well as you could, and you want some help, that's probably good enough for me. And that could be just sufficient as a clue. In case you're wondering, to me, the clue is you're having these intrusive thoughts. You're thinking a lot about cancer recurrence. Maybe you're having images. Maybe it snowballs into the what if. So if the cancer comes back, well, what if I can't go back to work? I can go back to work. Well, what if, we'll have to, maybe we'll lose the house. And what if we can't send the kids to college? So it's snowball. So if you're having these what ifs, and you're having these what ifs and these thoughts and these images, not just during those yearly appointments we talked about, but you're having them outside of test appointments. You're not just having them once or twice a year, you're having them most days. This is lasting at a minimum of 3 months. So, this is not an occasional thing. This is something that's quite consistent in your life. You're also repeatedly concerned that some physical sensations, aches and pains, some things in your body make you think that the cancer has come back, and you're quite convinced. So if you're experiencing that and you find yourself seeking too much reassurance, spending too much time online, really over relying on distraction, and if you feel like your day-to-day life is impacted, your relationships might be impacted, your ability to plan for the future. So if you're feeling stuck, you're feeling like you can't move past this would be a good indication. And briefly, to conclude, what should you look for if that's the case? If you feel like maybe I do need help, there's really great evidence in terms of science, of what we call a meta-analysis, when we pull all the scientific evidence together, and this is like kind of our strongest test. We find that what we call CBT, or cognitive behavioral therapy, or things like mindfulness, work really well, whether you get these interventions in a group format or one-on-one, whether you receive them in person, online, over the phone. And these interventions tend to be brief, sort of a 6 to 7 sessions. So this is not a long commitment in terms of therapy, but these interventions are shown to be efficacious. A quote from one of our interventions, which is a 6 week in-person group-based interventions, just to give you a sense of what you can expect from a fear of cancer recurrence intervention. Do not expect that your fear will decrease altogether and be gone, but do expect that you'll experience a reduction. A patient said there was a session where I actually experienced the pain and the emotions of my worst case scenario. We got her to talk about what she's really afraid of. It was very beneficial for me. It was kind of therapeutic for me because after that, I was feeling much better. I wasn't avoiding as much because I knew how it would feel. I knew I would be, and I had a plan to control the things I'd controlled on. So that's what people say when they go through a fear of cancer recurrence intensive intervention. They feel like the fear is gone, but I feel like I can manage it. So two sort of last slide, where can you find these interventions? So ask for a referral to your psychosocial oncology department, your cancer center, if there is one. Sometimes you need a referral from a healthcare provider. Some centers accept self-referral. Look for a mental health professional with experience working with people living in the community if there is no psychosocial oncology department available to you, or look for community resources. So, if you want to find out more about the fear recurrence therapy called FOR, you can check out our website, www.psolab.ca. And I'm happy to mention that Wellspring, which most of you probably know, is started since October to offer the Ford intervention online to people across Canada at no cost. And they will be continuing to offer this intervention, the 6 week intervention, for the upcoming 2026, sometimes in person, online as well, in person in certain locations. So that concludes my talk. I'm happy right now to take any questions that you may have. I'll stop sharing so that this feels a bit more intimate. All right. So any questions?
Hi back. So, as we wait, I have some questions that
Oh, cool. Great.
I know were given to me, knowing that, you'd be presenting. So I have some thoughts. And if I go back to the beginning of your presentation, would you agree that different level of anxieties occur to different stages of age and demographics and social differences in certain populations? So
Yes,
they're
for
varying,
sure.
correct?
Yeah. Yeah, so younger women for sure are more likely to report high levels of fear. They're more likely to report fear of cancer occurrence, and they're more likely to report high levels of fear of cancer occurrence. By young, we mean usually under 45, maybe under 50, depends on the definition for sure. Other than that, we find some studies find that women who have more intensive treatment, so chemotherapy and radiation and something else, may be more likely. Certainly, people that have more body aches and sensations and feel more side effects and symptoms, they're more likely to experience these triggers. Beyond that, there's no real difference between, marital status, having children, whether you're working or not, your income. We don't know a ton, especially in Canada, about the importance or the influence of ethnicity. We know that very few studies have shown that fear of cancer occurrence might be more prevalent in certain ethnicity, but to be determined. But younger women, for sure.
Right. And obviously, the support network has a lot
Mhm.
to do with how you manage that anxiety, right? And how you use that support, correct?
Yes.
Yeah,
Yes. So I find it so important that people look at the fears, of course, that they have about burdening others. Because remember, so people with high fear of cancer, because they often have a good support network, but they're scared to lean on the support network. But my message is often like, they're probably thinking about it and they're waiting for your cue to know kind of like, should I talk about this? Should I not? That being said, not everyone has supportive family and friends or supportive partners. So, hence why I think joining a support group where you feel like, okay, these people get it,
yeah,
can also be a great alternative. So, whether it's your own family or friends, or whether it's, creating a sisterhood, a community to get that extra support.
right. And if we discuss the level of anxiety, would you touch on the fact that some of us are coming in with a mental illness already,
Hmm.
comorbidity,
Yep.
uh, some form of anxiety. We all do. Our world has changed.
Hmm. Hmm.
So how does that amplify it? And how
Yeah.
does somebody get eased by being told that, there is a baseline and expected to be either amplified or not, depending on
Hmm.
what medication
Yeah,
he's on. So if you can touch
for
on that a bit.
sure. So I agree with you that clinically, I've worked with many people who told me, I was always described as anxious, a bit of a worrywart before I had cancer, but I felt like I managed. But now once I got cancer, then now I'm finding my emotions hard to control. So there is a bit of research that supports the idea that if you've had some anxiety issues before cancer, chances are that cancer can amplify that. That being said, I've worked with people who said, you know what, I never worried before, I never really had anxiety, and now I'm experiencing it. I think it could be a combination of like sometimes like what you went through during your cancer diagnosis, your cancer journey. It could be, sometimes we're aging, life circumstances could be thrown at us. Sometimes it's just too much. And it's normal to feel like, you don't have necessarily the same emotional capacity after cancer. So yeah, I think different people will bring different things, but of course, if you bring additional concerns of like mental health history, that could be an extra factor. Most of these therapies, good news is that they'll take you as you are. So even though you may have had, you may be struggling with other things at the same time, you can still join some of these supports. And what people have told us actually is that they're like, hey, the tools I learned and your forward intervention, I was then able to apply to other areas in my life where I worry, because it's similar tools. So if you're worried about this, well, you can apply it to a different kind of worry as well, so could be beneficial.
And moving on to all the tools that you beautifully exposed us to today. Um, One thing that resonated is what about when you're alone with yourself? And I
Hmm.
think that's a very important piece of all this, because when you learn how to do that, that
Hmm.
that anxiety is managed a little better when you're surrounded with your support, when you're discussing it with others, and it may even teach you how to minimize the anxiety that you feel you may overburden loved ones or ones that are in your life, and they don't, you feel that you're burdening them with the same thing over and over again. So would you say that if we start by learning how to be with ourselves and to pacify ourselves
Hmm.
first, so that we
Hmm.
can then move on with the rest of society? What do you think about that?
I think, yeah, you touch a good point in the sense that I see sort of both ways. Some people find it easier, of course, when they're distracted by having others around them, and there's nothing wrong with leaning on our support. That being said, sometimes they're like, I'm so consumed by my thoughts about the cancer occurrence that I feel like I'm not fully present with my family. It's kind of like always there on the back of my mind. So learning, people of course can learn to like practice relaxation techniques to sort of deal with it. And then I think what women who go through our group say is that I see that the trigger is, I recognize the trigger now. This is like a predictable trigger. Oh, somebody dropped this in the conversation that so and so had breast cancer. I know it's a trigger. I feel the rise in my anxiety, but I remember my tools. I tell myself, this is happening to this person, but it's not happening to me. I talk to myself in the moment. I tell myself, I'm doing the best that I can. I take a deep breath and the wave passes. Like the anxiety comes, but I know that I'll be okay. I can manage this. And just learning, you've got this. You've got tools. You can manage this, and the moment passes more quickly.
Right. And if somebody gets diagnosed young, they're hopefully, and that's where we're all wanting to do,
Mhm.
is to live a long life.
Yes.
There's going to be different times in your life where they're going to set in different fears You know,
Mm-hmm.
as you grow older, as your children get older, as the passages of life approach and come,
Yeah.
face to face. So those are
Mm-hmm.
all things that people have to be aware of and understand that today is not going to be the same as tomorrow and in
Mm-hmm.
the future with the best of hopes. So I'm going to move on
Mm-hmm.
to something else. I just because I'd like to give Sarah her the opportunity, but scan anxiety, okay, or scan
Mm-hmm.
anxiety.
Mm-hmm.
Um, you touched on everything on how everybody feels, and of course, everybody feels that. I think most
Mm-hmm.
everybody.
Yep.
One thing that I'm trying very much to work with is the medical part of it, like
Mm-hmm.
fast speed your results, for patients to get them as quickly as possible. Because
Mm-hmm.
if we do a better way of relaying it as quickly as possible, that minimizes it from the beginning to the end.
Mm-hmm.
When you're sitting in that waiting room for them to call you up for your mammogram, you know that once that mammogram is done, somebody is going to come to see you. I know the answer is not the right answer in the climate that we're in with our healthcare system and all the things that go with that. But that is something that could be so helpful to relieve
Mm-hmm.
that part of somebody's anxiety. So,
Oh,
food
for
for
sure.
thought for you, if you have
Mm-hmm.
any way to broaden that,
Yeah.
idea in the
Mm-hmm.
in the hospitals or wherever
Mm-hmm. Mm-hmm.
individuals are having their I have one question that I'd like to share with you that came in, and I don't want to disappoint them. And it says, this person is asking how to manage a lack of empathy from family members about her fear of recurrence. So if you can quickly touch on that
Mm-hmm.
before we hand it over to
Yeah, so there's a great video that sometimes we show in some of our groups by Brené Brown on what empathy is. And sometimes some people have found that helpful to share that Brené Brown video, what empathy is, which just is like, sit with me. Don't rescue me. Don't try to distract me. Don't tell me everything is going to be fine, but just allow me to voice my fears. Just allow me to say what's scary for me and just be with me here in the moment. Don't minimize, don't distract, don't just stay with me. Allow me here to say what I want to say. So I think in general, I encourage people to be very specific about what they need and what they need from their loved ones. Sometimes this might not be available for a bunch of reasons. I mean, some people do benefit from having couples therapy or family therapy if they really feel like this is a sore point between them and it's driving them apart. I would encourage people to be like, hey, as a family, is there something we can get from our cancer center?
Thank you. Thank you. We can
You're
go
very
on forever.
welcome.
Thank you. We're going to hand it over to Sarah. Sarah, please.
Hi, I just thank you so much, Dr. Lebel, for your um, presentation. There was so much in there that really was helpful for me. And, especially this last point about the Brene Brown video. One thing that it seems that we're really difficult is to just listen to people and not react and just let them kind of sit, let them be negative and sit in their pain and sit in their trauma for a while and just provide them that space to share. Um, and yeah, so thank you so much for sharing your insight. Um, I I also want to thank the Canadian Breast Cancer Network for inviting me here to share my story and my insights on this important topic. I thank you for honoring my story and the experiences of breast cancer survivors and patients across the country. I also want to thank everyone who's attending this seminar today. I see a lot of names that I know, people that I call my breasties, which means they're in my support group. And I also want to thank my main caregiver, my mom, who is on this call listening as well. She walked with me and carried me when I could no longer walk. So I want to thank everybody for your support. So whether you're here to learn or you're a survivor or a caregiver, a healthcare worker, just being here means that you're committed to mental health. And so, you know, for the purposes of this session, you know me as a cancer survivor, but that is not how I define myself. If I had to pick just one description, I would say I'm a story sharer. So for over 20 years, I've been sharing stories of people across Canada. I worked as a journalist for 10 years before moving into corporate storytelling and government story sharing. But the story I want to share with you today is my own, and it's what led me to my current role, which is amplifying stories in healthcare. So it was 2022. It was supposed to be amazing. If you remember, the world was opening up after COVID. For me, I was back at work. I was traveling the country, filming community stories for the company I worked for. And after 8 years of studying at night, I was about to finally get my Bachelor of Arts degree. And it was that April when I found what felt like a tiny pebble in my left breast. So by June, my cancer was confirmed, appointments with oncology were set, my biopsies were done, and it was time to cross the stage and get my degree. And while I was crossing the stage, you know, the whole left side of me was bruised from the biopsy that I had 2 days before that. And really, I remember standing up there and getting my degree, wondering if I'd live long enough to use it. So it was kind of a tough time. In Manitoba, where I am, once you're diagnosed, you move very quickly through the cancer system. So I know there's people on this call that a lot of survivors and patients on this call, but there's some that don't know about breast cancer. So my diagnosis was triple negative invasive ductal carcinoma. So what that means, triple negative means that my cancer wasn't driven by hormones like estrogen and progesterone and not by the HER2 protein. And the kind of cancer I had, triple negative, makes up about 10 to 20% of breast cancers. It's also extremely fast growing, aggressive, has a high risk of recurrence. It's more common in younger women like me. I was 43 when they found my cancer. So triple negative is typically treated with chemotherapy first, followed by surgery and then radiation. So from July to December in 2022, I had 16 rounds of chemotherapy, 12 rounds of a chemo that I'm allergic to, which meant extreme side effects. Like I was covered in a chemo rash everywhere, and I had chemo feet, which are like blisters on the bottom of your feet. So to fight the allergy, I was pumped full of steroids, antihistamines, and given a more expensive protein-bound version of the chemo. So that was tough, but little did I know it was going to get tougher. So in October, I had to skip chemo for a few weeks when I contracted COVID and was pumped full of antivirals. And then on my first dose of doxorubicin, which is also called the red devil for how it damages your heart, I developed an infection in my port, which is like a small device that's placed under the skin, and it has a tube that goes into a major vein. My port was faulty and it was leaking chemotherapy under my skin, but it wasn't noticeable until the first dose of doxorubicin. So my chemo stopped again while I was treated for the infection and had to have the port removed because it had developed scar tissue all around the port. So when they had to, it was a surgery where they had to take it out. But by the time I restarted chemo in December, I had a PICC line in my arm, but my tumor grew a lot. It was to the point where it was coming out of, like, it was affecting my skin. It looked like a red blister. That was pretty terrifying. So my last chemo was on December 24th, 2022. That Christmas was pretty tough. I had a bilateral mastectomy scheduled for January 30th. And I had never had a surgery before other than some stitches in my finger or my wisdom teeth removed, right? So I wasn't sure I'd survive. So we had a late Christmas party as a family. I focused on the positives, like enjoying the love of my family and friends. I spent January being a tourist in my own city. Like I went to the spa and went to galleries and museums, and I really just wanted to live. So my surgery came and went. I had the bilateral mastectomy after 16 rounds of chemo is difficult recovery. I had a lot of infections. Was hospitalized with a pulmonary embolism. I had 2 frozen shoulders at the same time. My pain wasn't treated properly, and I was diagnosed with post-mastectomy pain syndrome. I had a bunch of revisions, and my last stitches were finally removed after 8 months. So, and now I live with a lot of side effects from the chemo. I have chronic pain, neuropathy, and lymphedema. So throughout this whole year and a half, like the thick of my experience, the part of me that suffered the most was actually my mental health. So, you know, prior to cancer, I was really, I paid a lot of attention to my mental health. I've grown to be very self-aware, and I know when I'm starting to not feel well. So as soon as I entered the cancer system, I knew it was going to be tough. So I took advantage of all the programs they offered. Like there was talk therapy and group therapy, meditation, yoga, creative writing, art therapy. I kind of just did everything that I could. And during this recovery, I started noticing that I was feeling things that I had never felt before. Like I was afraid to drive. You know, as a journalist, I drove for a living. It was weird to me that I was all of a sudden afraid to drive. I was afraid of the dark. I started getting terrified of large crowds of people. I started worrying about everything and everybody. And I felt as though I couldn't hold conversations anymore, and that people actually no longer liked to be around me. Mostly, though, I couldn't shake the feeling that death was always on my doorstep. So every single pain I felt was my cancer back, and I would spiral into like very scary places. And so this is when I was actually diagnosed with post-traumatic stress disorder from my experience. And once I got that diagnosis, I was able to understand a lot more of what was happening to me. So I engaged in mental health supports. And one thing that helped me tremendously and continues to is cognitive behavioral therapy that I learned from working with a psychologist. So she taught me to chart out my fears. So I would visualize like a chart with columns, and like the first column was, this is what I think is happening or going to happen. And then the second column was like, what proof do I have that this will happen? And the third column was, what proof do I have that this will not happen? And then I make a logical decision based on the facts that I've gathered. So since I'm a storyteller, I'll give you an example of it in action for me. So last September, so September of 2024, you know, I was a year and a half after becoming NED, which is no evidence of disease. And you know, that was a tough year too. So like on top of the recovery, I also lost my job. And then the apartment I was living in was evacuated due to structural instability. So, you know, I had to move everything out in 8 hours. And like it just seemed to make things tougher for me. So fast forward to the fall though, I was in a new great job. I just bought my first house. Things were really great. But I started getting headaches. And now I've always had headaches, but these felt different. So like my eyesight was affected. Sometimes things would shake or like go blurry. And if I bent down and back up, everything would kind of like, it would just go white. So I started getting very afraid. So what I did is I went through my chart that my psychologist taught me. So, you know, I was afraid it was brain cancer. So the facts that I had that it was brain cancer were, you know, headache affecting my eyesight, breast cancer typically metastasizes to the brain. I've had cancer before. Now, the facts that I had that it wasn't cancer were, I've had headaches my whole life. I'm in medical menopause. I'm on medications, moved into a new house. It was fall. Like I typically get headaches in the fall. So when I walked through those facts I had and made a decision to call my doctor, what my psychologist taught me is that walking through this process will help me make a decision based on fact and not fear. And even though the decision was to seek out medical attention, I also know that one follow-up visit to my doctor isn't going to break our healthcare system, right? But by not calling, though, it might break me. So it really kind of validated the decision that I came to. Like I validated myself. by saying, okay, I'm going to call my doctor. I'm going to get this looked at. So in the end, I eventually had a brain CT and there was no evidence of brain cancer. And, further investigation led to my thyroid was damaged by chemotherapy, which is very common after the types of chemo I had. So on medication now, no longer have headaches. So that's the process I go through whenever I have this fear creep in. And it's helped me so much. Like, I no longer stay awake at night. I no longer, I don't even cry anymore because I can walk through this process that she taught me and actually come to a decision. And it really, validates it either validates or it calms me. So it's really great. So I hope that my story has provided some insight to what fear of recurrence can feel like, but why we feel this way, all the built up trauma that we experience. And I also hope and encourage anyone on this call to seek out help. If you feel that something isn't right, do it. We check up on our bodies, but we tend to neglect our brains and our hearts. So I want to thank you all for listening. And if any of you want to connect with me, I'm on LinkedIn. If you'd like to stay in touch, I'd love to hear your stories.
That's wonderful. Thank you so much, Sarah. I know that it's not easy for everyone to relay stories such as yours and others who have had, you know, terrible diagnoses and are learning how to live a new
Yeah.
normal. And sharing your story is probably one item might help somebody that's listening to, you know, make it better for them, right? So really, it takes a lot to relay a big story like that. And thank you so much. So last word, because we're coming to almost the end of my time here. What would be one thing that you would say to an individual who's experiencing such fear that it makes them their quality of life change?
I would say seek out medical attention for sure. I mean, I have a really amazing um, doctor who helped me through this a lot. And that's how I was able to actually connect with a psychologist to help me walk through that. Don't be afraid of therapy. It's not, I know it's kind of a weird thing where some people don't want to do therapy, but really, we'll go to the doctor for our bodies, like go to the doctor for your mind as well. That's really helpful, seeking out if you have somebody that will sit and listen to you and just listen, like Dr. Lebel was describing, and just kind of providing that supportive space and just, not minimizing you and not gaslighting you, and not trying to make you feel better by saying something. Those are important resources as well. So definitely, general practitioners are there for your body and your mind. So reaching out to them and seeing what options you have and reaching out to your local cancer center for what kind of supports they provide as well. I mean, it's there. Let's use it.
Thank you, Sarah. And so, last word from you, Dr. Lebel. What is the one thing that you would like to leave the audience with that you think would be the most useful?
Well, I'd like first to thank Sarah for sharing her story. Um, yeah, I think for me, the take home is like cancer is many times a traumatic event. There's just so much that happens to you, to your family, to your body, that it takes time to recover from what we've experienced and to sort of unpack all of that. But there is help available through your cancer center, your community resources, mental health professionals. You don't have to do this alone. That while it's normal to struggle, to have ups and downs, that you know yourself best. If you feel like, you know what, I think I need help with this, then don't try. I always tell people, why don't you try it once and then go for like one appointment, see what that's like, and then then make a decision.
Thank you. And so that leaves me to conclude our time for today's session. I want to thank you, everyone, for tuning in and some of the questions, and for joining us to learn about managing the fear of recurrence. And again, thank you, Dr. Lebel, and thank you, Sarah, for being here with us today, both with very, very valuable tools and ideas. And, you know, your story just will resonate with people that are going through this. Thank you again. I also want to thank again our sponsors, Novartis, Pfizer, Gilead, Bayer, Tessera, AstraZeneca, and Lilly Canada. Now, following this session, you will get a link to complete a survey to provide feedback on the session. Please consider leaving feedback, as this really helps us to improve future sessions for attendees like yourself. Once the recording is available, Rebecca will share a link along with resources shared in today's session. And if you haven't already, be sure to sign in for the next week's session with Dr. Karen Gelman on what recurrence means from a medical perspective. Have a wonderful afternoon. Thank you, everyone.
Thank you, everyone. Bye.
Thank you.